convinced the Senate that monies deducted by her ministry at source for the leasing of specialized medical equipment to counties was a grant and that county governments have not paid a single shilling for the equipment. Kariuki also failed to produce documentation and agreements between the national government and the 47 county governments on how the grants would be utilized in compliance with the Public Finance and Management Act. The CS asked senators to invite her counterpart in the National Treasury to explain the contradictions in payment for the leased medical equipment between the two levels of government.
Consultation or where consultation.
On Tuesday, the Control of Budget told the Senate Ad Hoc Committee on Health that county governments have paid a total of 25.9 billion shillings in the last 3 financial years for the specialized medical equipment. The Council of Governors told the Senate governors signed the lease agreement under duress and were clueless about its terms and conditions.
The disbursements related to this program are a bit unusual.
And I can tell you when I signed it, I even didn't want to read it because equipment was already there. So what was I going to read to change?
The Cabinet Secretary for Health found herself in a tight spot when she tried to explain why the funds are micromanaged at the ministry.
No county is paying a shilling for the leased equipment.
We can't let that pass. Go to your Annex 5 so that I walk you through.
Let her finish cheating, as you say, or lying, then we can correct it. Counties are not paying for this managed equipment service. The letter from National Treasury dated December. Can you share that letter with us? I will give you a copy. It concludes by saying the funds allocated to the managed equipment program is from the national government share of revenue raised nationally.
Your predecessor, James Macharia, says, after informing counties what you want to do,
yes,
in turn, the county government will be the lessee, whilst the national government will be the principal. Of course, the contractors will be the lessors. And in order to ensure that budgetary allocation to the counties are applied to meet the lease obligations. This is a letter from your ministry. Was your predecessor telling a lie?
It was anticipated at that point that the counties would contribute. That position was actually vacated. And the actual position was that then the burden reverted totally to the national government through a conditional grant.
Where is the letter as a follow-up to Annex 5 to tell the counties that, contrary to what I said in the earlier letter, it now does appear that your budget allocations will not be interfered with?
Then it means there is a fraud somewhere, because then some of the funds that have been allocated to counties as part of allocation, if you're saying it doesn't involve Kara.
The leasing of the specialized medical equipment has been riddled with controversy and secrecy. Governors are yet to receive copies of the lease agreements, despite signing a memorandum of understanding. Governors have also cried foul after the lease for the use of the equipment for each county was varied from 95 million shillings to 200 million shillings annually.
I had been asked actually the same question when I came into the ministry. So I really had to also seek my colleague in National Treasury to confirm what is the position, because I was myself confused.
The MES payment is part of the 316. And indeed, when you give a conditional grant, the money stops being yours.
The monies for MES and conditional grants for leasing of medical equipment, it is true it is captured as a conditional grant in the CARA, but when we are doing our budget as a national government, this money is allocated to the Ministry of Health.
Under the PFM Act, you cannot disburse any money without proper documentation. Can you, as the finance officer, give this committee agreements between your ministry as part of the national government and each of the 47 counties to show that you have given them a conditional grant, the conditions of the grant?
Senators wanted to know why the Cabinet Secretary has not formed a task force to look into the grievances surrounding the leasing of the medical equipment.
This was not summit. This was not summit. This was a cabinet subcommittee.
No, he told us, to be fair to him, the direction from the president was at the summit, that the Ministry of Health will be tasked to form a task force to look into this matter.
Can we agree that from your end, there was no instruction from the summit for you to form a task force? The media was also here.
Why don't we converge here, the two of us together, so that I am not reporting on
We will do that if you are required to do it.
Minister, the safety valve for you is that you don't attend summit. If any such direction was given, you are waiting for communication instead of engaging in a test of wills with others.
Pati Kamimo, KTN News.
Nobody will punish you for not knowing.
Now, Jack Songo is Kenya's president of all 9